Are you ready to take control of your own health? Do you want to create a plan that will improve your health and vitality without the use of synthetic drugs or needless surgery? Hi, this is Dr. Tom Roselle. I would like to invite you to join me and the Roselle Center for Healing for an information, fun-filled day that will change the state of your health and quality of life. Ageless Health 2011 will provide you with the resources to begin your journey towards being stronger, having greater physical performance, and living longer without impairment, pain, or disease. Ageless Health is about realizing that your health is a do-it-yourself program. You can have it all. Ageless Health 2011 is your first step towards creating and enhancing your natural health plan. Register today to reserve your seat.
Ageless Health 2011 is September 17th at the Fairview Park Marriott. Learn more at rosellecare.com. Don't miss out Ageless Health 2011. Register today. Call 703-698-7117. 703-698-7117.
Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio waiting to take your phone calls. 888-630-9625. 888-630-WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied. Well, guess what? This is your opportunity to figure out how to put the fix in, how to actually get it done without drugs, without medication, and get your life back. Wouldn't that be a novel concept? Actually, wellness is what your birthright's all about, and we're here to show you the path. We have a topic for you today, but remember, you don't have to be on topic to call us. And I have an expert in the field, somebody who I think the world of, who is an intellectual go-to person for this type of condition. It's something that we all sometimes have a little bit of a challenge with, and trust me, yours truly, absolutely. And we're going to be talking about attention deficit disorder and attention deficit hyperactivity disorder, and it can affect not only children, but pay attention, folks, adults as well. And I am one who has been plagued with it on several occasions over my lifetime, simply because of injury and trauma and things that have happened to me that have caused the old brain to scramble a bit. And the lady, the doctor, the expert that I have with me is Dr. Jennifer Sims, who many of you know. Dr. Jennifer, good afternoon.
Good afternoon.
I'm ready, you're ready, and we're going to talk about a very profound subject. And, you know, we need to start out with, most people really don't get, they don't understand what ADD, ADHD truly is, both in the profound application of it. You know, everybody thinks that it's some kid just bouncing off the walls and can't sit still and can't pay attention and can't hold a thought in their head, you know, for 2 seconds. But it's far more than that, and it's there on very subtle levels with all of us. Why don't you take us through the path and tell us a little bit about what ADD, ADHD actually is?
Well, we know that, for starters, that ADD, or more often called ADHD now, is really a disorder. It's a mental disorder, not a disease process like it seems to be. I don't know what the word is.
Well, it's diagnosed as a psychiatric disorder, right?
It's in the DSM-4 manual, which is the psychiatric disorder manual. So when we think of a disease or a pathology, we think of, you know, doing blood tests, you know, x-rays, scans, things of that nature that substantiate that there is a disease, a pathology. So the same doctor could run the same blood test in one place, and another doctor can run it in another place, and it could definitively say you have this disease. ADD, ADHD is not one of those things, but I think it's important to start off by saying that it's not a disease. It's considered a mental disorder.
So when we're dealing with a mental disorder, are we talking about something that is a result of brain chemistries that are not up to level, or is it an electrical imbalance, or is it an intellectual thing? What is it? The latest thought process on that is not normal levels of dopamine in the brain.
Once again, hard to substantiate, not consistent testing to prove that, just the latest theories. There's also been things done with PET scans and other types of brain imaging that have not held up consistently to say, you know, this is the definitive cause of this. What they do say in the DSM-4 is the hallmark behaviors are short attention span, distractibility, impulsivity, and hyperactivity. I am sure that on any given day, one of us will fall into this category of maybe all of these things or one of these things and not necessarily have this mental or this disorder.
Well, most of my staff think that's where I am most of the time.
Right. And just a little history, it used to be, the school of thought used to be it was a learning disability. In the 60s, it wasn't called ADD, ADHD, it was called schizophrenia. Now we're seeing that 1 in 10 children are diagnosed with ADHD. So genetically, our genetics have not changed that much in this time period to have it truly be a genetic disorder.
So we have let me see if I get this right, because it's a functional capacity problem. It's
right.
One that manifests itself in the apparent inability of a child or an adult to be able to focus continually on one subject, or to do it at a rate where it's in line with other standards, if you will.
Right.
And it's one where we see children who can't stay in one confined area or in one task for any length of a period of time. Is that right?
Yes.
Okay. So that takes in the whole world.
Pretty much.
I mean, as a kid when I was growing up, I went through stages of if my concentration was there, I could do anything. But how you had to teach me is that you had to put my hands on it. And if I put my hands on something and it was something that would emotionally lock me in, I could learn anything. But if you took me outside of that and you just gave me something to read, I understood the words I was reading, but if I had to reflect back and apply it without using symbols or hard objects or whatever, I couldn't get it done. So in those days, I would have been classified as an ADD, and somebody wanted to drug my brain and do all those kind of things. But let's go back a little bit to the new rationale of dopamine. Mm-hmm. Serotonin and dopamine metabolism doesn't start in the brain. It starts in the intestinal tract.
Right. We know that most of our neurotransmitters are actually found in the intestinal tract, right? So that gut feeling that you get really is something you need to listen to, because we do have more serotonin neurotransmitters in the gut than in the brain. Right?
No, 80%.
Right.
It's mind-boggling when we take a look at society in general. We talk about pass-throughs genetically, we talk about predispositions genetically, and things environmentally can either enhance or suppress. And when we look at our food sources and substances today, we know that food isn't as good as what they say it is, even when you're going to the store and you're buying vegetables and different types of grains and so forth, because they've been so modified, they've been sprayed, they've been altered and so forth, which enhances this depletion, the breakdown of the formation of those substances of serotonin and dopamine. So, knowing that, now my question to you is this, in your opinion, is ADD, ADHD a genetically predisposed situation where kids going to be stuck with it, and is environment that's going to either suppress it or balance it, or is it one that we can that happens to us because of what we eat?
Yes.
Oh.
I think it's a lot of things. When you've got a child that is bouncing off the walls, that is a very true experience as a parent that you're having. It's not to take away that your child is not having issues. I want to make that clear. Or even an adult is experiencing these issues. I do think that the environment that we live in is much different than it was 10, 20, 30 years ago. We're exposed to a lot more toxins, a lot more genetically modified foods, food dyes, really poor pregnancies, not getting enough nutrition during pregnancy, exposures to heavy metals, the increased rate of doctor-assisted births, which can cause neurological damage, which can manifest in this type of behavior. I mean, there's a litany of reasons on why we have so many children having emotional behavioral problems.
So we're talking about trauma, we're talking about injury, we're talking about biochemical imbalances, we're talking about anything that can alter the body.
Right, and then just even the home situation, the caretakers, the social dynamics of the home, all those things make up how your child reacts to their environment. And all of those things really need to be looked at and addressed, and not be lumped into, okay, well, you've got this disorder, so we're gonna essentially dumb you down by telling your brain not to worry about this and just focus on this.
So this Wednesday evening, my guest will be your host, this Wednesday evening in our in-house continuing education program, Dr. Jennifer Sims is going to be talking to you about ADD, ADHD problems from trauma, from biochemistry, and so forth. We'd like to invite you, as we always do, Wednesday the 27th, this coming Wednesday evening, 7:30 p.m., in our office at the Roselle Center for Healing, just off the National Capital Beltway in Fairfax. All you have to do if you'd like to attend Dr. Jennifer's presentation is give our office a call. It's 703-698-7117. That's 703-698-7117. So if you've been suffering with not being able to stay focused, if you've been suffering with not being able to pay attention for any length of period of time, and you'd like to know whether or not this is... But, the interesting thing is 30 to 50% of all children continue to manifest this as time goes on. So as adults, no matter what your age, you may have this problem that's stopping you from learning, from focusing, and a lot of and there's another correlation that I've seen is that a lot of this is being shown as we get older, as the inability to assimilate and grasp information that's back there, and we're saying that it's age-related dementia, and that's a story we could talk about as well. But this Wednesday evening, we'd like to invite you at the Roselle Center for Healing. Dr. Jennifer Sims will be your host. The 27th of this month at 7:30 p.m. Dr. Jennifer, let's go to a place of talking about, we'll pick this apart. Let's talk about trauma.
Okay.
And so a child goes along and they're doing really well, or an adult goes along and they're doing really well, and all of a sudden trauma takes place. There's a blow to the head because they fall and hit something, they bang their head on something, or there's a whipping effect that causes the head to vacillate in a way that the brain bounces off the sidewalls. How does this affect us?
It absolutely affects us because of the nerves that come off of the cervical spine, the neck, if you will. Those nerves, when that head gets jammed or hit, or that whole area of the body gets damaged, you're going to notice things like maybe hearing loss that can manifest in what you think is a behavioral problem, but truly a damage to the ears, or constant ear infections. You're going to notice inability to concentrate. You're going to notice a lot of the things that are hallmarks for ADHD, not being able to sit well. All of those things, you're going to notice their neurology is not going to be where it needs to be. So that's why it is important to have a list of things that you can check besides just assuming it's just this one disease process or disorder, if you will, and there's nothing you can do.
Well, we're talking about something that is near and dear to me. 4.5 years ago, coming up 5 years, the end of October this year, as you know, I was in a very severe automobile accident, head-on collision, where a drunk hit us at 50 miles an hour. And for quite a long period of time after that, my brain was not processing the way that I normally process. It wasn't quick. I was having a problem grabbing words that meant what I want them to express. And it took me a long time, with your help, with the help of the other guys in our office, and actually doing some brain mapping and some biofeedback, I was able to get to the place where I don't struggle like I did. But it was profound. It's that sort of thing that people don't realize can have an impact, and things sometimes that are more subtle than that.
That's right. And we've got to remember, too, that our vision centers originate in the back of the brain, right? The back of the head. So sometimes it could be a problem with vision. I'm not being able to see so that they can't focus, or see very well the letters on the page, so that the reading is more challenging for some of these children. And the right-left brain and how it communicates. We know that as a baby, if your child doesn't crawl and just goes to walking first, we know that's how the right and left brain start communicating in infancy. And if we miss that stage, we have neurological problems that manifest in learning disabilities, that manifest in ways of not being able to focus.
This Wednesday evening, Dr. Jennifer Sims will be your host at the Roselle Center for Healing, 7:30 p.m. on the 27th. Be there with us if you'd like to talk to her more about some subtle problems that you may be having, things that you didn't know where they came from, and all of a sudden your capacity to assimilate information has shifted, and you notice that you have to do other things. You have to have these training wheels, if you will, to be able to learn anymore. Well, she's the one. She's the expert. She's the one that's going to be able to help you out of this mess. Give us a call at 703-698-7117, and you can call us here at 888-630-9625.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We're talking about ADD, ADHD, and remember, you don't have to be on topic to call us. My guest in studio, Dr. Jennifer Sims, our expert in this type of problem. Dr. Jennifer has spent the majority of her career dealing with ADD, ADHD in children and in adults, and it's a problem that does trans over, and we said 30 to 50% of adults that were kids who had it continue to have it. So this is not something that you ignore, and it can happen biochemically because of things that are going on in your diet. It can happen because of trauma. It can happen because of emotional stresses. The list, but you have to remember this is a psychiatric functional disorder. There are really no biochemistries that are absolutes. There are a few things that are pointed to. We just talked about a dopamine imbalance, but it's one that really has other considerations. We have, and we're going to talk to Dr. Jennifer about that in a second. This Wednesday evening, the 27th of July, Dr. Jennifer will be hosting an in-house continuing education program on ADD, ADHD at the Roselle Center for Healing. If you'd like to attend that and get more information, please be our guest. 703-698-7117. That's 703-698-7117. That's how you reserve your seat to our class. Dr. Jennifer, let's talk a little bit more about this mechanism. Second half, I want to go in and I want to talk a little bit about what we can do and what we can handle, but let's clear the playing field a little bit more. How does someone know whether or not they have, from your basis, an adult, let's talk about adults for a second. You have an adult and suddenly they suspect something, but they don't know. How do they know?
It's usually not suddenly, and it's usually considered personality quirks. These people typically are the ones that can't finish what they start. They just can't organize things very well. They're late for appointments. They are well-intentioned but make really careless mistakes. Forgetful, always misplacing things, difficulty concentrating. Poor sense of direction, get lost a lot. Typically people who just can't relax or unwind. Those are usually adults that have just learned to cope with what they've had since childhood. But it does play a part in their professional lives, and they may not get the promotions that they want or be able to do the things that they need, or not the person you necessarily would think of in your mind that you would count on in all those types of situations.
We have some phone calls coming in. Let's take one. Scott, are you still there?
Yeah, good morning.
How can we help you, sir?
A couple months ago, you hit on your show about iodine deficiency and ADHD.
Correct.
So I have a son in PAC school, preschool for autism. A couple days a week, the teachers would say that he was kind of not there, and he wasn't talking at all. Mm-hmm. So after your show, I went to Whole Foods and bought a bottle of kelp iodine, started crushing it up, putting it in his yogurt in the morning. 3 days later, the teacher, when I picked him up from school that Wednesday, said to me, "What did you do to this child?" And I said, "Iodine." And she's top professional in this thing in the school system, and she was almost incredulous.
Well, Scott, refer her to an article that was actually published a few years back in 2004, and it was published in the Journal of Endocrinology and Metabolism, ADHD and Iodine. And it goes on to talk about the study where iodine-deficient mothers were more likely to give birth to children with ADHD. And this is prominent in third world countries, but it's something that, unfortunately, because of our medical system designed the way it is, we don't look at it. In that program, we talked about the epidemic form, as far as I'm concerned, of iodine deficiencies in this country.
Well, I know I've also been taking a little bit myself, just because I have to assume I'm probably deficient, and I know this is all anecdotal, but I do feel like I'm sleeping better.
You will. So, if you're iodine deficient, you will and once you put the iodine into the system, your whole body begins to normalize itself because you're getting your thyroid to work, your tyrosine and your trace minerals are going to be much more efficient. When that happens, you're going to be able to sleep better.
Well, I noticed also the glands in my neck I didn't really notice it as being swollen, but they don't seem like there's bumpy now.
No, they won't, because they help drain the lymphatic system. Scott, thank you for sharing that. That makes what I do worthwhile, and I really appreciate you letting me know about that. And it's something that we need to share ongoingly. That's why I do what I do. That's why we do the program.
I also want to just chime in on the TBI in a car accident.
Go.
That my own experience with that 30 years later, if it wasn't for vitamins and minerals and amino acids, I would not be here.
Scott, thank you very much.
Right,
I appreciate that. Thanks for calling. Dr. Jennifer, that's the kind of thing that makes what we do, warm and fuzzy, and I say thank you very much, and I'll keep doing it until I can't anymore. This Wednesday evening, the 27th of July, Dr. Jennifer Sims is going to be doing an evening on ADD, ADHD, and all those innuendos that we're talking about today, realizing that a lot of the problems that we see have to do with trauma, have to do with the body's inability to handle certain problems. Dr. Jennifer, we've got about 30 seconds before we have to go to news. Quickly, tell me, as far as you're concerned, is ADD, ADHD something that can be resolved pretty much in the majority of people?
If you take a multi-approach, yeah, absolutely. I don't think one thing can resolve it, but yes, I think that there's ways to manage some of the behavior, clearly figure out what's going on nutritionally, because there's always a component. Always, always, always. Yeah, I think you can do a lot.
We're going to be talking about the high and the why of that statement.
Dr. Tom Roselle live on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live at 888-630-9625, 888-630-WMAL. That's how you call and ask me any questions, and you ask Dr. Jennifer Sims, my guest, any question that you like, particularly on the subject for her on ADD, ADHD. And this Wednesday evening, she's going to be doing a special evening at the Roselle Center for Healing on the different aspects, if you will, of that disorder. It's a functional disorder. It's not a disease. It's not a pathology. And this is something you need to know. And we're going to talk about some of the drugs that are given to you that really mess you up. But if you'd like to talk to her, 888-630-9625. That's how you do it today. But if you'd like to attend the class, which we encourage you, Wednesday the 27th, give our office a call, 703-698-7117. Dr. Jennifer, let's talk a little bit about different types of treatment. We'll talk about the medical, which I know I'll get you cranked up about as soon as we start talking about the drugs. But let's talk first about some things as simple as vitamin D that seem to be in the literature lately, and they're saying that vitamin D has the capacity in some people to really shift things relative to ADHD or related disorders. What do you know about that? What have you heard about it?
Well, we know that for vitamin D specifically, you need vitamin D for over 1,000 different processes in your body. That alone is amazing. And the fact that it does have such a great impact on mood, when you're deficient in it, how depressed people are, you run a normal vitamin D blood test, and you would be in shock on how many people are truly vitamin D deficient, especially on the East Coast here.
70 to 75%.
Because we don't get enough sunshine, and we have to realize that getting enough sunshine means going outside every day, 365 days a year, with no hat or sunblock on to actually absorb vitamin D appropriately. And you've got to be out there for at least 20 minutes or so to absorb it. And then we know as we age, we don't absorb it as rapidly as a child would.
Skin gets hard, tough.
Right. So when you do let your kids go out and play, make sure that they go out and play. And don't put the sunscreen on them. I know it's heresy to say that, but don't put the sunscreen on them. So they can actually absorb the vitamin D. So when it comes to hyperactivity disorder and the emotional instabilities that come with that, vitamin D is something that's really, really important. It works really well with the omegas too, which we've talked about before on essential fatty acids and how important they are to brain chemistry and how neurotransmitters function and the rate at which they function when you have the proper oils
If you don't,
in your body.
If you don't get enough omega-3s, you can't absorb your vitamin D. It can't get into the brain.
So they go together really well, and it's definitely something that you need to have checked. Very simple blood test just to check to see if you're vitamin D deficient. I know anecdotally, and I've had a lot of women who suffered with postpartum, and as soon as you get them on vitamin D, the fog lifts. It's amazing.
And that happens with people who, in the area that we're talking about, ADD, ADHD, they're in a fog, if you will. There's that type of perception where nothing seems to be inputting. They can't get a hold of it. They can't hold on to it. Their attention levels go down. But vitamin D is potentially a tremendous kick to prop up these neurotransmitters in the brain, these neurochemistries.
Yes.
Learning and memory problems in children, both of which are heavily present in ADHD populations, but not even children. We're talking about adults as well. They're tied to deficiencies that can go back even prenatally. It's like, which came first, the chicken or the egg?
Right.
There's a process in neurology called synaptic plasticity, and that means it relates to the ability of memory, foundation, function, capacity to retrieve memory in the body, the easiness of it, if you will. It extends both to children and adults, and the implications are very, very specific when it comes to vitamin D's role in that process, that function. It's amazing to me. But you get the depression, you get the SAD disorder that you were talking about, the seasonal affective disorder, the fog that goes along with it, the inability to function. So many of these things are intimately related. Let's talk about a little bit about the drugs that both adults and children are being put on to handle this thing. Why do they work, and why are they so dangerous?
Well, they do work. I mean, they will get your child or yourself to focus on that task at hand. The problem is a lot of these drugs have not been tested long term. We know the dangers of Ritalin. I mean, everybody knows that it's becoming something that gets snorted to get high. We know it's a very addictive drug. It's a Schedule II controlled substance, the same category as heroin and morphine. I really don't think it's appropriate to put children on things like that, or the class of drugs. Then we have the amphetamines, the uppers, right, that give that paradoxical effect that even though they're supposed to excite you, they calm you down. That would be the Adderall. That's so widely used and promoted as being safer, which in my opinion is not. We also know that in other countries a lot of these drugs have been pulled off the market because of the increase in suicide and depression and other factors that are very dangerous that kind of outweigh the reason to take them to begin with. So, and we know that what the studies that have come out is taking these medications actually have long-term effects. Just like antidepressants, it shrinks parts of the brain. It atrophies parts of the brain. You can't get that back. And there's other things that go along with being on these medications later on that you might not notice at the time. The abdominal issues, the GI problems that come with it, depression, which people don't realize that there's a link between what those chemicals do to the brain and how they can cause depression later on in life. So, we could spend hours on the side effects of these medications and how truly inappropriate, in my opinion, they are for anybody, but let alone developing children.
It's an interesting thing. You start looking at American lifestyle, American diet, American stress levels, and it's no wonder that ADD, ADHD-like types of conditions have risen dramatically, exponentially, if you will, over a period of time. And I know that we could talk about inoculations and the relationships that are there, and I'm going to get into that in a second or two. But I know this Wednesday evening you're going to get into these things in detail. You're going to answer all kinds of questions. So if you have a problem, or you have anybody in your family that you think may have a problem, there's some really simple solutions. I would encourage you to attend Dr. Jennifer Sims' presentation in our in-house continuing education program this Wednesday evening, the 27th of the month, 27th of July at 7:30 p.m. at the Roselle Center for Healing. To do that, we just ask you need to make a reservation at 703-698-7117. That's 703-698-7117. And tell my staff that you'd like to reserve a seat. As always, the classes are a gift to you. They're our way of helping people try to get their life back and also to give you some options relative to treatment. You can talk to us here today at 888-630-9625. Dr. Jen, there's one of the things that I've always seen with adults and children with brain function, and it has a tremendous linkage to what we're talking about, is iron deficiency. And there's a lot of articles out there that are suggesting that iron is not, if we're not getting enough of it and we have it, or we do get enough of it and it's not being transported, can cause problems with children, particularly in the subject we're talking about, but also with autism. What's out there, Anna? What are you aware of? Because it's a critical factor in the synthesis of dopamine, which we just talked about a little while ago.
Well, we know that with iron deficiencies, you're going to get the symptoms of confusion, depression, headaches, those type of things that can often be misdiagnosed for or included in the ADHD diagnosis. We also know with just deficiencies in general, I mean, they're really significant. For example, we talked a little bit about serotonin earlier on in the program, and serotonin is produced from tryptophan. So if we don't even have, the precursors to some of these things, we're going to show imbalances, and we're going to show that in behavior and how we relate to other people in situations. So nutritional and mineral deficiencies are huge, and in my opinion, extremely overlooked and even poo-pooed, like the caller that we just had, about how he told the teacher how the kelp, the iodine, and not iron, but the iodine helped his child. And it's like, oh, that couldn't be.
Well, when the teachers are given a checklist, they're not told anything about the why or the how come behind these things. They're just, well, if your kid does this, this, and this, and we've talked about so many times that the school systems are funded for the number of people that are diagnosed with ADD, ADHD problems. The state writes a check for it. And so when you have that type of motivation behind the governmental agencies that run our school systems, and you have teachers that are only taught to recognize it based on the symptom process, and that for every child that they have on these medications that they're given more money for, there seems to be a fox in the hen house, so to speak.
Yeah, I mean, there's a lot of social issues that go with that, too. Public schools are overcrowded. It used to be that maybe there was 1 or 2 problem children in classrooms. Statistically, there's a lot more. They don't have the resources or the time to deal with the children that need more attention. So it's very easy to just say, you know what, your kid is hyperactive. I recommend that if they want to stay in my classroom, that you put them on medication. So there's so many issues with that, but the bottom line is it's not what's in the best interest for that child. And there is issues. There are monetary gains for public school systems in those situations. And why not? If you can label a bunch of kids with problems and get more special programs, then, it seems like you're helping them in some way. It's a very distorted way of looking at health in our society, but that's what it's come down to. Let's drug them.
And they buy into it in such a fanatical way. It's, you try to talk to people on a legitimate, rational explanation of what happens, even physicians. I've said it many times, unfortunately, so many docs, as well-meaning as many of them are influenced by the detail people that come into their offices, and so much of this research is funded by the drug companies. The drug companies are not there to see you dead. They're there to keep you in a place of maintenance. They want to maintain your health. Well, maintaining your health means putting a whole lot of garbage in.
Yeah, keeping you sick.
Yeah.
Well, too, with Ritalin, there's that whole conflict of interest that the informational pamphlets that are put out for a lot of these medications are put out by the people who make the medications. And those are the pamphlets and the information that's being sent to school systems, that children and adults with ADD, we know that is funded by Novartis, who makes Ritalin. I mean, it's just so blatantly transparent, the special interest, and that the special interest is not the health or welfare of the child, but of a monetary source instead. You've got to think about all those things, and everybody is an individual, and they all need to be treated that way when it comes to any kind of condition, but certainly this.
It's, you look at the medications. There's a drug out there that Concerta, and that's amazing to me that they would even begin to allow a child to take that, because the side effects are huge. The damage that it does, the addictive process that it has, the suppression of immune function, and you want to expose that to a young child that is growing, it's unconscionable.
What's interesting is how many of the children that I work with that will come in, and the reason that they're coming to see me is because they'll tell you, I don't feel good on these medications. I have weird thoughts. I can't sleep. I don't have the taste for food, and that's what the kids are saying. So, it's definitely something that should not be the go-to thing to do, in my opinion.
My guest today, Dr. Jennifer Sims. We're talking about ADD, ADHD problems. She'll be your host this Wednesday evening at the Roselle Center for Healing, and how you register is 703-698-7117.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live, and we've been in studio at 888-630-WMAL. And as always, love to take your questions on any subject that you have in mind. We're here every Sunday to try to give you the most up-to-date information. And this Wednesday evening, Dr. Jennifer Sims, my guest in-house, is going to be your host and your presenter at our in-house continuing education program. 27th of July, 7:30, she's going to be speaking to you on ADD, ADHD problems, the fix, what you can do about it, the intimacies of all those crazy meds that you might be on. And remember, as an adult, you still have the same problems, and come from diet, can trauma, can become from stress. Once the brain isn't functioning, it's not functioning, you get to see all these other things that they medicate you for. If you'd like to attend, 703-698-7117. That's 703-698-7117. I promise you, it'll be a night that you won't forget, because she's going to give you the substance, the stuff that you can use immediately to turn things around. Want to also remind you that Thermography Center's ongoing sponsor of Dr. Tom Roselle Live. If you'd like information on thermographic imaging and add it to your annual health evaluation, call Dareth Painter at 703-943-7248. That's 703-943-7248. Dr. Jennifer, we've got a couple minutes left. Take us through, what are you going to really talk about this Wednesday evening when you do your presentation in our office, and what can people gain by coming?
We're going to talk about exactly what ADHD is in the textbook sense, but what I'm really going to focus on is the differentials that you can look at to see why you or your child is having such a hard time. Coming from birth on, looking at allergies, blood sugar, thyroid, heavy metal toxicities, nutritional deficiencies, the ways you can test for these things that, not everything lives in the blood. We'll talk about that. Things live in saliva, urine, and poop. We're going to talk about some nutritional things that you can do to work on some of the areas if you are deficient, and just some other multi-approach type of things like sensory integration, neurofeedback, chiropractic, obviously, those type of things. So it's going to be more of a practical way to look at what's going on and look at some things that maybe you haven't addressed before, and kind of guide you to where to go.
I learn something every time that I listen to you, because I know you're studying this field all the time. It's part of what you do on a day-to-day basis in our practice. It's amazing to me the amount of information that's coming out that people really don't know about, because it's not being exposed publicly, but it's there, and it's researched, and it's applicable, and it can resolve many problems. So if you'd like to hear some of this information that I'm truly amazed with, give us a call at 703-698-7117. Tell my staff that you'd like to attend. Dr. Jennifer, as always, it's a pleasure. I'm delighted that you're here. I could talk to you all day long on any subject. It's amazing to me when it comes to your breadth and scope of knowledge when it comes to this and many other areas. We're here every Sunday at 12 noon, bringing you the most up-to-date information possible on integrative care. This is Dr. Tom Roselle. See you then. Bye. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a Do-It-Yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, RoselleCare.com. That's RoselleCare.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is